Hey everyone, I wanted to take a few minutes today to talk about psychotropic drugs or medications that we use to help manage our emotions in our brain. There's a lot of misinformation out there about drugs like this. I'm not going to clear all of that up today, but there are a couple of things I'd like to focus on. One is some of the common reasons that people don't want to take drugs like that to help with anxiety and depression specifically. The first and the huge reason is it still has a real big stigma attached to it. Somehow, many people think that it is a weakness of character to need to take brain drugs in order to manage one's emotions. This bums me out so much. I mean, I can't even tell you. It's really silly, actually. I mean, if your car was broken and you had the tools to fix it, you'd fix it. It's no different with psychotropic medication. If you feel bad every day, if your depression is, crippling you or paralyzing you or just making your day is like really gray and crappy and hopeless, and if you can take something to just feel like yourself again, why wouldn't we do that? Well, so again, one of the reasons would be the stigma associated with it. Another reason I hear people talk a lot about is their fear of side effects. I can't sit here and say that no one ever has any side effects ever, because that's just not true. There are side effects. And one of the things that I get upset about is that oftentimes people are prescribed brain drugs and they aren't monitored appropriately, in my opinion. Sometimes a PCP will do a prescription and the patient won't check back in for a long amount of time, or a psychiatrist will write a prescription for something, and psychiatrists really only see you for like 20 minutes, once a month or once every 2 months. In my opinion, that is not sufficient oversight for someone trying a new brain drug. My opinion is that drugs should only be prescribed to people initially when they're under the care of a therapist, a psychotherapist, a counselor, social worker, that sort of person, someone who does talk therapy. Because the impact of the drug needs to be assessed pretty regularly over time. Like I'd say at least once a week for the first at least 2 months. So it upsets me that often doesn't happen. And if it did happen, the question of side effects would be a lot less problematic, right? Because we'd be under appropriate care as we explored this new drug and what its impact on us might be. The third reason that I hear people talking about not wanting to try drugs is that they're afraid that if they try them, they won't be themselves anymore. This is a huge one. That people are under the misapprehension that taking an antidepressant or an anti-anxiety medication will turn them into a zombie, or will make them weirdly upbeat, or any number of things that would sort of derail their self-identity. That's a huge concern. And if you don't have any proof or knowledge about it that tells you otherwise, I can certainly see that preventing one from wanting to give it a shot. In my experience, certainly there are probably exceptions to this. In my experience, one's personality does not change. It's more like I said earlier, you just feel like yourself again, like yourself on a pretty good day, if the drugs are working. Or another analogy that I use, it's not particularly creative, but it's accurate. It's like before the drugs, every day is just cloudy and gray. And after the drugs, some of the clouds maybe part a little bit and you can see some of the blue sky. You can see enough blue sky that you have hope. And you feel like, yeah, maybe this day is worth engaging in. So brain drugs don't change your personality. They can have side effects. And people trying new drugs should be closely monitored, I believe, by a talk therapist, not just a psychiatrist or a primary care physician. The stigma associated with taking brain drugs and the questions of self-esteem, and is it a flaw in my character, or is it a weakness that I just can't pull myself up by my bootstraps? Those kinds of ideas are things that can also be addressed in talk therapy. So just by willing it away, that's kind of silly, right? Because it's a cultural belief. So it's also not a weakness of character to think it's a weakness of character. But that is something that can be sorted through in talk therapy. So that's yet another reason that I would recommend doing, trying new drugs and doing talk therapy at the same time. The other thing I wanted to talk about today is a relatively new phenomenon, and that is doing genetic testing to determine what brain drug might be the best one for you. So it's new. Hasn't been around a long time. A lot of people don't really know about it, including me until recently. And so I just want to share with you a little story about a client that I have who lost his wife to cancer several years ago and has really been in a crippling depression since then. And he had been prescribed Prozac and really didn't see much of a difference, which often is the case when you're on the wrong brain drug. You don't have bad side effects a lot of the time. You just see there's nothing and you're like, okay, is this even working? And if you feel that way, probably the answer is no, it isn't. So anyway, he was on Prozac for 2 years, and he didn't feel any better, and he wasn't making any progress. He was extremely frustrated. And this is someone who was working very, very hard in his talk therapy and his treatment otherwise. So his doctor suggested he do genetic testing to find out if this Prozac actually was the best drug for him to take. So he did the test. The results came back. It wasn't just not the best drug for him to take, it was the worst drug for him to take. Amazing, right? So he got off that and got on the drug, which happened to be Wellbutrin, that the test said would work for him. And within weeks, he was feeling better. Again, not like I'm healed, that my life is perfect now, but feeling better enough to start doing some of the things that he hadn't been able to do in 2 years, like leave the house. I'm not kidding. Walk the dog, return text to friends, things like that. So this was a huge step for my client in terms of his recovery from the grief of losing his wife. And I know there are some legitimate qualms that people have about genetic testing, and myself included. But in the case of brain drugs, because in the past, all doctors did was just, throw darts in the dark, like, here, try this, try this, try this. And it was a total crapshoot, honestly. It's so frustrating. So many people wasting so much time on drugs that didn't work, or they weren't sure if they were working, or whatever. Now we have the ability to dramatically improve outcomes. So if you are thinking about trying some brain drugs, I would recommend doing genetic testing to see which would be the best drug for you. I'm gonna end on a personal note and say that I have suffered from depression and anxiety. Well, depression from a very young age, and anxiety starting in my 40s. Pretty significant levels of both. Very significant, I'd say, at times. And what has helped me get moving has been taking antidepressants and then anti-anxiety medication. So I speak from experience. I'm not just, telling you this, I'm sitting on high, preaching to you. I know that my brain doesn't work great without drugs. It's just the way it is. I like to say sometimes my brain is just broken. And like my car analogy earlier, another brilliant analogy, I found some tools to help my car run better, my brain run better. And I'm very grateful for them, because otherwise I don't think I could do this job. I don't think I could be a good mother or a good wife. And I am able to do all those things. And, I've just come to accept that that's the way it is for me, and it's okay. So I just wanted to share all these thoughts with you today in case you're sort of on the fence, or you think drugs might help, or you were confused about side effects or any of the things I just talked about. And as always, feel free to reach out to me on the PsycheFinder website if you have questions or you want to debate my points. Always open to debate and dialogue, or just anything else that's on your mind relative to what I've been talking about today. And also, I will be going on spring break starting tomorrow, so I won't see you for about 10 days, lucky me. When I get back, hopefully I'll have lots of interesting new ideas and topics to talk about, and I look forward to seeing you then. Be well. Thank you.